Now, vitamin A. So, another name for this vitamin A, it is the retinol, okay, and it is also called as anti-xerothalmic factor. Carotenoids and provitamins that are found in what? They are found in plants. So, this vitamin A chemically it is a retinol, and this vitamin A, it is one of the major constituents of fat-soluble vitamin. Now, when we talk about the vitamin, we must know how it is absorbed, what are the sources, what are the requirements, what are the functions, and what are the deficiency diseases associated with that vitamin. Okay, and with the fat-soluble vitamin, there is one more point it is there, as they are not excreted out of the body, in a very small amount they are excreted. There you can say higher doses of these vitamins that will cause the hypervitaminosis. So vitamin A, coming to the absorption of vitamin A, it is absorbed in the small intestine. Presence of bile and bile salts, it is necessary. And where it is stored? Vitamin A, it is stored in what? It is stored in liver, slightly in the lungs, kidney, etc. The requirement for adults 500 international units, pregnancy and lactation 6,000 to 8,000 international units, and children 2,000 to 3,000 international units. That is the requirement. Now sources, all of us, we know the sources. Every colored vegetable or every colored, you can say, fruit, they will be rich source of vitamin A. Animal liver oil, cod liver oil, then eggs, milk, carrots, yellow vegetables, fruits, papaya, etc. Okay, these are the good sources of this vitamin A. Okay, so when we talk about vitamin, we first know about their chemistry, then their absorption, their storage, requirement, sources, then functions of that vitamin, and then further what the, you can say, the deficiency diseases related to that vitamin. Okay. Now, what are the functions of this? You can say the vitamin A. It helps in maintaining the integrity of the epithelial tissue. So, vitamin A, it is mainly required for what? For maintaining the integrity of the epithelial tissue. Now, this vitamin A is also required for what? Normal formation of the bones and teeth. For formation of the bones and teeth, presence of vitamin A or vitamin A must be there in adequate amounts. One more function, this vitamin A, it prevents the secondary infection. Whenever there are the chances of infection, so vitamin A will act as a what? It will act as an antioxidant, or it will prevent the secondary infection. Now, the further function, it prevents the urolithiasis. What do you mean by urolithiasis? Urolithiasis means formation of the renal stone or the kidney stone, which is the commonest problem. Now, these vitamin A, it is involved in metabolism of the nucleic acids. Okay, so vitamin A is involved in what? In the metabolism of the nucleic acid. And one of the most important function of this vitamin A, they are essential for the vision for both rods and the cones. Rods and the cones, these are the, you can say, mainly present in the eyes, or you can say in the retina, and these you can say there is a rhodopsin, a characteristic protein or a chromoprotein which consists of a pigment retinine, same as vitamin A, and a protein opsin. Okay, so this vitamin A is essential for what? It is essential for vision, and for vision for both rods and cones in the retina. Okay, rhodopsin, it is a chromoprotein which consists of a pigment retinine and same as that of a vitamin A and the protein opsin. So this rhodopsin, it is a visual pigment present in the retinal rods. Its color, it is preserved in the darkness and bleached by the daylight. Its mission, it depends on the vitamin A. Okay. So these were the generalized functions of what? Of the vitamin A. Okay. Now, other functions of this vitamin A, that the role of vitamin means the functions, when we talk about their functions, the vitamin A role, it has been given by the scientist, that is called as Waltz. So Waltz visual cycle, it is also one of the important aspect of vitamin A. Now, the different forms of this vitamin A, they have different function. For example, retinal and retinol, they are involved in vision, whereas retinoic acid, it is involved in cellular differentiation and it is a regulator of a gene expression. Okay, so in different forms, retinol, and you can say retinoic acid, this vitamin A is present. So retinal and retinol, they are involved in vision. Retinoic acid, it is involved in cellular differentiation. Okay. Now, what is most important aspect of this vitamin A? As already I have told it to you, that is the role of vitamin A in what? In vision. So the cyclic events that occurs in the process of vision, that is also called as a rhodopsin cycle or Wald's visual cycle. From examination point of view, sometimes this Wald's visual cycle, it is asked as a short note. Okay. Now, photoreception in the eyes, it is the function of the two specialized cells called as rods and cones that are located in the retina, the rod cells and the cone cells. Both rod and cone cells, they contain a photoreceptor pigment in their membrane, and vitamin A, it is a component of that pigment. Okay. Rhodopsin or visual purple, the visual pigment of rod cells in the retina, consist of what? 11 cis retinal bound to the protein opsin, and that is called as rhodopsin. Okay. So the cyclic events that occurs during the process of vision, it is also called as what? The visual cycle. So the first event in the visual cycle, when rhodopsin absorbs light, the 11 cis retinal, okay, it is converted to all trans retinol. Okay. Now the isomerization, it takes place. Okay. When rhodopsin absorbs light, the 11 cis retinol, it is converted to what? All trans retinol. The isomerization is associated with a conformational change in the protein opsin. The third event, the process generates a nerve impulse that is transmitted by the optic nerve to the brain. The fourth event, this is followed by dissociation of all transretinal from opsin. The all transretinal is immediately isomerized by retinal isomerase to 11 cis retinal. This combines with opsin to generate rhodopsin and complete the visual cycle. Okay. Now the conversion of all trans retinol to 11 cis retinol, it is incomplete, and therefore most of all trans retinol, it is converted to all trans retinol by alcohol dehydrogenase, and it is stored in the liver. And when needed, retinol re-enters the circulation and it is taken up by the retina. Okay, where it is again converted back to 11 cis retinol. Okay, so these are the events that takes place in what? In the visual cycle. Now, naturally, we know there is a color vision also. While vision in the dim light, it is mediated by rhodopsin of the rod cells. Color vision, it is mediated by three different retinal containing pigments in the cone cells. And these pigments, they are called as porphyroxine, iodopsin, and the synopsin. Okay. If red, if it is porphyroxine, it splits. Green, if iodopsin, it splits. And blue, if synopsis, it splits. Okay. So this was about the role of vitamin A in vision. Okay, which is one of the most important function of the vitamin A. Now, one more function of this vitamin A, it is the cellular differentiation. So retinoic acid, it is an important regulator of gene expression especially during the growth and development in the neoplasm. And retinoic acid, it is essential for normal gene expression. Okay? So expression of a gene, it is also one of the important function of what? Of this vitamin A. Now, what are the metabolic effects of these, you can say, retinoic acid? Retinoic acid, it exerts a number of metabolic effects on what? On the tissue. Retinoic acid, it controls the rate of gluconeogenesis in the liver. Okay. What do you mean by gluconeogenesis? It means formation of a glucose from non-carbohydrate sources. So retinol, it controls the rate of gluconeogenesis in the liver by stimulating transcription of the gene for phosphoenol pyruvate carboxylase, which is the rate limiting step in the gluconeogenesis. Now, this retinoic acid, it also control of biosynthesis of a membrane glycoprotein and glycosaminoglycans. Okay. Now, it also controls the biosynthesis of a cholesterol. Okay. These were the, you can say, the metabolic effect of retinoic acid. Now, so many times we hear the word antioxidant. Okay. So this vitamin A is the powerful antioxidant. Antioxidants are the substances that will prevent the oxidation of the tissue, oxidation of the membrane. Okay. So what is the antioxidant function of this vitamin A? Beta carotene, it is an antioxidant and that may play a role in trapping peroxy-free radicals in the tissues. Okay. Now, the ability of the beta carotene to act as an antioxidant, it is due to the stabilization of organic peroxide free radicals within its structure. Means the free radicals, they are the free oxygen species. And this vitamin beta carotene, it will act as an antioxidant by stabilizing the organic peroxide free radical within its structure. The antioxidant property of the lipid-soluble vitamin A may account for its possible anti-cancer activity. So vitamin A, it is given in the treatment of cancer, and as its antioxidant property, it is used for the anti-cancer therapy. High levels of dietary carotenoids, they have been associated with the decreased risk of cardiovascular diseases. Okay, so we have seen what is the chemistry of the vitamin A, absorption of vitamin A, requirement of vitamin A, what is per day requirement, then sources of vitamin A, then functions of the vitamin A. Okay, how it then in the functions, the most important role of vitamin A in the vision, and in the vision we have seen the visual cycle or the relaxing cycle, the details of that. Then the role of vitamin A, retinoic acid, the metabolic effects of this retinoic acid, then the antioxidant function of this vitamin A. It prevents urolithiasis, it prevents the secondary infection, it is required for the vision, for the normal functioning of the body, for the growth of the body, etc. Okay. Now coming to the what, when we talk about the vitamin, we must know what are the, you can say, already I have told it to you that hypervitaminosis means the, you can say higher doses of vitamin, specifically the fat soluble vitamin, they will have certain side effects, they will have certain bad effects. But as such, for the water soluble vitamins, these effects are not there because being water soluble, they will excess of these vitamin or B complex vitamin or water soluble vitamins, they will get excreted through the urine. But that is not the thing with the fat soluble vitamins. So the deficiency manifestation, so there will be a hypervitaminosis which is associated with the vitamin A, that is excess of vitamin A intake, and specifically, but the deficiency manifestations, they are much more common. Okay. So vitamin A is stored in the liver and deficiency of this vitamin occurs only after prolonged lack of dietary intake. Vitamin deficiency may be primary that is dietary insufficiency or secondary. What are the causes of secondary deficiency? Impaired absorption of lipids, as in celiac diseases, topical screw, gastrectomy, or obstructive jaundice. And failure to synthesize ApoB48, therefore inability to form chylomicron, into which the vitamin A is normally incorporated after absorption, or lack of lipase, as in pancreatitis, then failure of converting beta carotene to retinol because of an enzyme defect, then impaired storage of the hepatic cell in the liver diseases, failure to synthesize retinol binding protein. These are the some of the causes or secondary causes of vitamin A deficiency. Now coming to the symptoms of this, there are the changes, degenerative changes that are seen in the eye skin, and they are commonly seen in individuals with vitamin A deficiency. Okay, so what are the commonest, you can see, symptoms? Night blindness, that is defective adaptation. Okay, then keratomalacia, that is opaque appearance of the corneal epithelium. Xerophthalmia, that is keratinization of the lacrimal glands. Then Bitot spots, that is the appearance of opaque spots on either side of the cornea. Then Crinoderma, that is stone-like scaly skin, and urolithiasis, stones in the urinary tract. These are the symptoms of vitamin A deficiency. Okay, there will be failure of growth in the children. There will be faulty modeling. There will be abnormalities of the reproduction, then nerve lesion, and certain forms of skin diseases that are the certain deficiency diseases associated with the vitamin A. Now, see, when we talk about the, you can say, vitamins, these vitamins, they are widely used in the field of medicine also. Okay. So, what are the therapeutic uses of this vitamin A? Vitamin A supplementation, it is known to reduce mortality and complications in patients with measles. Okay. So, that will prevent the complications associated with the measles, especially in the children. Then currently acute promyelocytic leukemia, it is treated with the administration of all trans-retinoic acid and as a preliminary to the chemotherapy. Okay, the use of retinoic acid preparation as topical dermatological agents in the treatment of psoriasis. Okay, these are the therapeutic uses, and some precancerous lesions, they respond to the treatment with carotenoids. Is it clear? Now, already I have told it to you. When we talk about the, you can say, the fat-soluble vitamins, there is a possibility of a hypervitaminosis. Means there are the, if that vitamin it is taken in the higher doses, naturally it will cause the hypervitaminosis. That is the toxicity of vitamin A. Now, what are the toxic effects? The toxic effects, they will occur with hypervitaminosis A as a result of what? Ingestion or excess vitamin as a side effect of what? Inappropriate therapy. Hypervitaminosis A occurs after the liver storage of retinol and its esters exceeds 10,000 microgram of the tissue. Okay. Now, what is the acute toxicity? What are the major changes or symptoms that are seen with the acute, you can say, toxicity? Most important, abdominal pain, then nausea, then vomiting, then severe headache, then dizziness, then sluggishness and irritability, followed within few days by re-squamation of the skin and finally the recovery. Okay. What is the chronic toxicity symptoms? Chronic toxicity from moderately high doses taken for a protracted period, and it is characterized by the symptoms such as what? The symptoms are, you can say, bone pain and the joint pain, then the hair loss, then dryness and fissures of the lips, then anorexia, then benign intracranial hypertension, weight loss, and hepatomegaly. These are the certain symptoms associated with what? Associated with the chronic toxicity of this vitamin A. Okay, so today first we have seen what are vitamins, introduction to the vitamins, their general characteristics, then classification of the vitamin into fat soluble and water soluble, and then we have studied the details of vitamin A. What are the sources of this vitamin A? All of them are knowing. Okay, so any colored vegetable, then the meat, then the milk, etc. Carrot, papaya, then you can see cucumber, etc. These are all the good sources of what? Of the vitamin A. And what is the characteristics? That is the, you can say it is the one of the most important vitamin of the fat soluble vitamin. Okay. Now coming to the what? The second vitamin of the type. And the second vitamin, it is what? It is the cholecalciferol. Okay. Cholecalciferol. It is the, you can say, another name for what? For the vitamin A. Okay. So cholecalciferol is one of the, you can say, important for what? Important for the vitamin A. Sorry, the vitamin A, then the vitamin D. Okay. And what is this vitamin D? As already you know, the vitamin D is also called as what? It is also called as the, you can say, the cholecalciferol. Okay. That is about the vitamin D. But other vitamins that you can say about the other important aspects of the vitamins we will study afterwards. Okay. Right now, we will study now. We will return to the other topic, that is the immunoglobulins. एक और लेना है लेकिन ये कन्वर्ट कर देते हैं दूसरी फाइल में